Parents, did you know that we actually have an emergency line to handle any dental or orthodontic concerns when we are not open? Stay tuned to watch this video to find out more information. Hey y'all, I'm Amy Morgan. I'm the marketing coordinator for Pediatric Dental Associates in Orthodontics. And in this video, we're going to be discussing dental emergencies. First and foremost, we feel it would be very beneficial for you to know exactly what a dental emergency is, especially when it comes into context as us as a dental office versus you as a very concerned parent. When it comes to us as a dental office, there is really only one true dental emergency, and that would be an avulsed permanent tooth. Now, this is because you are not going to be able to get another tooth in place if that tooth comes out. I really want to make sure we focus on the permanent tooth for this type of emergency. Now, this type of emergency can happen while a child is just walking down the street. It can happen during a sporting event. It can happen as they're getting out of the pool. It can happen for a variety of reasons. But if your child has a permanent tooth that comes out of their mouth, fully and completely out of their mouth, then this is known as an avulsion. This is an emergency where you need to be seeing a dentist very quickly. Now, as a parent, there are going to be a lot of dental issues that might come up that you may deem an emergency or at minimum a concern. Now, at PDA&O, we do offer after-hours emergency call, meaning that we have someone on call 24/7 anytime we are not open that can help you with any of your true emergencies or regular dental concerns. All you have to do is call our main number, hit the correct buttons, and it'll put you through to where you can leave a voicemail to let us know the concern, and then someone will return your call within the hour. Anytime a child has a dental concern, especially as a parent, you're going to want to make sure that you contact the dentist as quickly as possible. We do not want to see our children in any kind of pain. If they have some type of accident where they've fallen and maybe they've chipped a tooth, or even if they have a severe cavity that may have led to an infection, we want you to contact us at any time and let us know your concerns, and we'll be happy to address them. When it comes to triaging these situations, we will ask you some questions, make sure they're actually our patient, and several other things that will come into play. Once we have all of that information and we've gathered that data, we will then be in contact with the dentist on call. The dentist on call will then make a decision as to what we need to do, whether that means the child needs to be seen immediately or if it's something that can wait until the next day that we are open. Aside from an avulsed tooth, some of the emergencies that you might end up calling us for could be related to orthodontics, any kind of swelling, any kind of general dental pain, and a chipped or broken tooth. Now let's break those down a little bit piece by piece. For an orthodontic emergency, you're going to want to call the main line, leave us a voicemail, and one of our orthodontic assistants will return your call. Most of the time, these are for brackets that have fallen off or poking wires that are really bothering the child and we're not open. For generalized pain, when you call the line and you leave a message, we're going to call you back and we're going to figure out exactly what's going on. How long has it been since he's seen the dentist? Did he have any cavities that maybe we had treatment planned last visit and we just haven't had a chance to get those fixed yet? So we will be asking kind of a dental history, and we will use that information along with a photo, and we will send that over to the dentist, and then the dentist will make the decision as to whether or not we need to call in some antibiotics or if we just need to wait until the office is open again. Now, some of the confusion comes in between chipped and broken teeth, and there are two distinctions there. A chipped tooth to us means that just a small area of the tooth has chipped off, and this would be no more than half of the tooth. Now, if they broke their tooth, meaning that more than half of the tooth is broken, then that is a little bit more concerning to us versus a chipped tooth. And it is because a broken tooth that can go more than halfway up the size of the tooth could have nerve exposure. If you have that nerve exposure, that is what's going to be causing a lot of the pain, sensitivity, and discomfort. Now, not to say they cannot have that with a chipped tooth, but most of the time you're going to see that with a broken tooth that does have nerve exposure. So again, in this instance, we would ask for some of their dental history, ask about how the accident may have occurred, and then we'll want a photo of the tooth to try to determine how many millimeters or how far up the tooth is broken. This will help us to determine whether or not we feel like the nerve has been exposed. If there is a nerve exposure and your child is having a lot of sensitivity to even just the air or just the wind or talking, then that usually will tell us that we need to have somebody come in and at least put some type of sealant material on that tooth until we can actually get them in to get it fixed. Here at PDA&O, we tend to see a lot of these type of emergencies as far as chipped teeth, broken teeth, or avulsed teeth during the warmer months. And this is because everybody starts getting back outside, they're riding their bikes down the street, they're learning how to skate, they're in the pool. There's all kinds of things that can happen during the spring and summer months that may not happen during the fall and winter months just because they're able to move around a lot outside. And so we do typically see an increase in emergencies during the spring and the summer. We do recommend that if your child is riding a bike, especially mountain biking or any kind of BMX biking, any kind of sports that would be considered contact sports, but some that maybe you don't even realize might need this type of device, but we want to make sure that they are always wearing a mouth guard when warranted. Even though these mouth guards may be uncomfortable, we do want to try to encourage you to keep trying to get them to wear one. We are seeing a lot of professional, specifically basketball players, wear mouth guards more because even though basketball is not considered a contact sport, you do tend to get elbowed in the face if you're coming down for a rebound, or the ball could come and hit you in the mouth. So even in these sports such as maybe basketball or even baseball, those aren't considered contact sports, but the way that they are played and the devices that are used while they're playing can cause harm to their mouth. A baseball could pop up, a ground baseball could pop up and hit them in the mouth. They could get hit in the mouth with a bat. Like, there are all kinds of things that can happen just even in that more individualized sport of baseball. And we do see those accidents in our office all the time. So we are encouraging you that if your child is participating in any type of sport, that they do start to try to use a mouth guard. Another thing we want to try to encourage you as parents is to have your children be more aware of their surroundings. Now, this is specifically going to come into play with an example that I have of a swimming pool incident. We had a couple years ago a 5-year-old child who simply was just trying to get up out of the pool. They were just pulling themselves up on the side of the pool, and they incidentally hit their mouth on the side of the pool because they couldn't hold themselves up, and they went back down. And because of that, their tooth chipped off on the side of the pool. So these things are happening more than what you think they are. So you just want to make sure that your children are aware of their surroundings, that they're practicing, water safety in general, but also just being careful as they're maneuvering through the world. Not running around a pool, not running, in places that are not safe. We had an accident, just in the last few weeks of a child their parent was pushing them in the stroller. They're 23 months old. The stroller got caught on a limb and the stroller fell forward and the kid hit their face and their mouth on the ground. So these types of accidents happen. They are accidents. And no, you do not have to put a mouth guard on your child in the stroller. But what I am trying to say is just be aware of what is going on and start to teach your children about those things to try to avoid some of these accidents. And lastly, I really want to concentrate on talking to you about swelling. There are several different types of swelling that we see in the dental office. Some of it is just general slight swelling on the gum line where maybe they're not brushing appropriately or they're not reaching that area when they're brushing. And then there's swelling that is definitely more visible. It can also be seen on the outside of their face, such as in their cheek area, in their eye area, or even in their jaw area. If you are seeing any type of swelling, it is definitely advised that you go ahead and give us a call and let us try to triage that. We would treat this as any other emergency, meaning that we would get your dental history, ask some questions, and also ask for a photo. It is usually indicated by photo of whether or not this is an infection or a brushing issue. If it's a brushing issue, we'll talk you through some steps to try to get that taken care of. If we do feel like it's an infection issue, then we're going to most likely prescribe some antibiotics and see you on the next business day to talk about what we need to do to take care of that tooth. Now, there is one exception to this in that if the swelling is severe, if it is very visible in their face, if instead of seeing a little swollen cheek, you're seeing a knot in their jaw or their eye is starting to close, that is a severe infection. And that is usually something that we would send to your physician if they have an on-call service, if they have Saturday hours or something like that, or we may even refer you to your local emergency room. And this is because the antibiotics that we are able to prescribe are only being able to take orally, meaning they can only swallow them. What sometimes in these instances, they actually need an IV antibiotic, which can reach that infection much faster. Now, if that has to happen and we're telling you to go to the emergency room, we're going to talk you through it. We're going to let you know, like, it sounds a little bit more severe than what it actually is, but we really would like for a medical professional to make the call as to whether or not they think an oral antibiotic or an IV antibiotic is best. Overall, we just want you to know that we are here for you. Whether we are open in our normal office hours or our after hours emergency line, we want to make sure that you always have access to great dental care. If you have to call us for an emergency, we promise to give you excellent triage treatment. And also, if it's needed, we do have dentists that will come in after hours to treat your child. If any concern comes up, even if it was not listed here, go ahead and give us a call if you have any concern at all. Even if it's after hours, this is why we provide this line specifically for these issues. And we have parents call about different things all the time. So don't be scared. If you have any inclination that maybe something is wrong, don't hesitate to give us a call. And again, that's just going to be our main phone number at 479-582-0600.